Well, it is one of the top threats facing hospitals. We're talking about ransomware attacks. You have cyber criminals holding data hostage, putting patient lives at risk.
Tonight, 8 on Your Side is taking a deeper look into the threat after an IT security event at a Florida hospital. Our investigator Masa Saidi is tracking the danger for us tonight. Masa.
Jen, Keith, good evening to both of you. So if you are badly injured in the northwest part of the state, you depend on Tallahassee Memorial. It's the main trauma center in the area. But for nearly 2 weeks, this hospital had to divert heart attack, stroke, and trauma patients away after a cybersecurity incident. Tallahassee Memorial Healthcare has now fully restored its computer system. After a 13-day shutdown, hospital staff returning to electronic medical records, ditching pen and paper notes. TMH called it an IT security event after the fix last week. In a statement, the hospital warning patients to expect hurdles. Their systems, vast and intricate. Quote, "We brought them online strategically and securely to ensure the best possible care for our patients." TMH now rescheduling canceled procedures as law enforcement continues to investigate.
My former colleagues and I at the FBI speak almost every day.
John Rigi is a cybersecurity and risk advisor for the American Hospital Association, which represents almost every single facility in the U.S.
Hospital CEOs now consider cyber risk as one of their top enterprise risk issues. So they're working very, very hard to ensure that their technical defenses have been increased.
Rigi says the biggest concern is ransomware groups. Russian, Chinese, Iranian, and North Korean cyber criminals encrypting data, holding it hostage, then demanding payment to return access. It can cripple a hospital's operations. On this public portal, the Department of Health and Human Services tracks the theft of protected health information. Last year, there were more than 500 attacks impacting 44 million people. Rigi believes 20 to 25% involved a ransomware attack.
When we have ambulances being diverted, elective surgeries being canceled, diagnostic technology being shut down, obviously that increases the risk of a negative outcome for the patient.
Right now, the federal government taking aggressive action to disrupt networks. After a high-profile attack led to fuel shortages in 2021, the U.S. Department of Justice elevated ransomware attacks, giving them the same priority as terror attacks. So the exact nature of the breach at TMH has not been revealed, but it is widely believed to be a ransomware attack. Meantime, a cybersecurity firm that we're in touch with says that it's really difficult to get accurate stats here. They do believe the true number of incidents is higher than what is being reported.
So what do they say what's behind the increase in hospital attacks and these threats to hospitals?
They actually say it's the pandemic. As hospitals were dealing with the crush of COVID patients, they had to increasingly rely more on remote technologies. It helped them take care of patients, but it also increased the digital attack surface, is what they call it.
All right.
All right.
Thank you, Masa. If you have something you'd like Masa to investigate, you can call the 8 on Your Side helpline. There's the number, 1-800-338-0808.